For tomorrow's health, here's Ashley Morrison.
There's been an alarming rise in the number of heat-related deaths over the past decade. According to a new study, heat was blamed for 412 deaths in the U.S. in 2014 and more than 2,300 last year. The study found a downward trend between 1999 and 2014 before a significant spike over the next 9 years. Researchers expect this increase to continue and say local governments in high-risk areas should invest in cooling centers for the public. To prevent burnout, doctors should rely on non-physician collaborators to take notes on patients. A study from the University of Maryland found providers who use scribes and other forms of collaboration increased the number of patients they see by 10%. Doctors who most relied on others decreased the amount of time compiling notes by about 20%. And people who got myocarditis from COVID-19 had more complications than those who got the heart inflammation from mRNA COVID vaccines. French researchers looked at 4,600 patients over an 18-month period. 2% of post-vaccine myocarditis patients needed to be hospitalized for another heart-related issue, compared to 7% of those with post-COVID myocarditis. Those are some of today's top health stories. For tomorrow's health, I'm Ashley Morrison.